So right at the efficacy data, good results, 78.9% vaccine efficacy at preventing symptomatic disease. Importantly, that with regard to severe or critical disease requiring hospitalization, there was 0 in the vaccine arm and 5 in the placebo arm. The good news is also that there was comparable efficacy across ethnicity and age, namely a very good efficacy, 79.9% in participants who are 65 years of age or older. The vaccine hesitancy surrounding AZ related to reports from the European group that there was a greater incidence of thromboembolic events associated with the vaccine. During this trial here, there was no indication at all. Now, remember, you're dealing with 30,000 people in a trial. The important thing to point out is that when you give vaccine to millions and millions of people, you got to make sure that when you look at the occurrence of what could appear to be an adverse event, that you essentially compare that into what the background of that type of event would be anyway in society. And the European Medicines Agency, the EMA, indicated in their examination that they did not see an increased risk of these types of events. Of note, in the trial that I just reported on, they did also not see this, even though it was only in 30,000+. But as Andy mentioned just a moment ago, the FDA is going to very, very carefully go over all of these data. There will be an application for an EUA, and I can tell you, you can rest assured that the FDA will put a great deal of scrutiny in every aspect of these data.
So we're going to hold on any judgment other than what Dr. Fauci's indicated from these studies until we hear from the FDA, and they will go through a very rigorous process. And after that, we will help interpret the results to the public.